The title of our presentation is Apply Patient Safety Solution to Clinical Practice. Why is it so hard? I don't know why it's so hard, but I will try to explain you our problems to analyze the causes why it's so hard. And about the healthcare, obviously, is not only an Italian issues. Is a world issues in this moment, because Sarah will show some that is important dates that demonstrate that the risk is very high or adverse event in hospital in every part of the world. I am not sure if we have similar problems with the other domains. I am not sure, but I think I know that we can improve, we can learn from the other domains, in particular from healthcare reliability, high reliability organizations. And my first slide, the difference in safety and reliability. This table is in our paper, and the discussion is open. If the hospital can become a high reliability organization, there is an answer to these questions. But obviously there are some difference. For example, the hospital small but frequent accident, while in high-risk organization, few accidents, but very important as dimension. The victims are the patients in hospital. In a high-risk, high-reliability organization, obviously can also the pilots can be the victims. We have our organization have some peculiarities, and I don't think that is simple, this comparison. But these are the most important difference. For example, we have, also in my experience, the patient safety culture is not developed in our healthcare system as in other sectors, industrial sectors, and the study demonstrates that. And for example, the perception of unsafe climate is major in healthcare operators than compare naval aviators. This is in a study. Gaba is an anesthesiologist. And we have another peculiarity in our activity is the emotional involvement. Often the surgeons don't feel the stress, the occupational stress. On their perception of the stress is lower than the other professionals of the other field. And we work in an environment where we have a direct relationship between the doctors and the patient. The technology barrier is thin in our context. And we have some possibility to improve the safety in our system, and our possible utopia is to become ultra-safe system. But we are far to this arrival. And it's necessary to, we have some barrier to ultra-safe. No limitation in production, excessive autonomy of actors, craftsman attitude, particular of the surgeon, egocentric safety protection, and loss of visibility of risk. And I think that is possible to resolve some of these problems. And now Sarah entered in this subject, but I think that we have a specificity and experience system social organizational barriers that make them difficult to transform into healthcare reliability organization. I think that we can apply many solutions of this organization for improving our context.